This presentation will give you an overview of the different types of mental illness. Mental illness is a general term for a group of illnesses that may impact a person's thoughts, perceptions, feelings, and behaviors. Mental illness can make it difficult for someone to cope with work, relationships, and other demands. The relationship between stress and mental illness is complex, but it is known that stress can worsen an episode of mental illness. Most people can manage their mental illness with medication, counseling, or both. Anxiety disorders are a group of mental health disorders that include generalized anxiety disorders, social phobias, specific phobias, for example, agoraphobia and claustrophobia, panic disorders, obsessive compulsive disorder, and post-traumatic stress disorder. Untreated anxiety disorders can lead to significant impairment on people's daily lives. Behavioral and emotional disorders in children. Common behavioral disorders in children include oppositional defiant disorder or ODD, conduct disorder CD, and attention deficit hyperactivity disorder ADHD. Treatment for these mental health disorders can include therapy, education, and medication. Bipolar affective disorder. It is a type of mood disorder previously referred to as manic depression. A person with bipolar disorder experiences episodes of elation and depression. The person may or may not experience psychotic symptoms. The exact cause is unknown, but a genetic predisposition has been clearly established. Environmental stressors can also trigger episodes of this mental illness. Depression is a mood disorder characterized by lowering of mood, loss of interest and enjoyment, and reduced energy. It is not just feeling sad. There are different types and symptoms of depression. There are varying levels of severity and symptoms related to depression. Symptoms of depression can lead to increased risk of suicidal thoughts or behaviors. Dissociation and dissociative disorders. Dissociation is a mental process where a person disconnects from their thoughts, feelings, memories, or sense of identity. Dissociative disorders include dissociative amnesia, depersonalization disorder, and dissociative identity disorder. Eating disorders include anorexia, bulimia nervosa, and other binge eating disorders. Eating disorders affect females and males and can have serious psychological and physical consequences. Obsessive compulsive disorder OCD, is an anxiety disorder. Obsessions are recurrent thoughts, images, or impulses that are intrusive and unwanted. Paranoia is the irrational and persistent feeling that people are out to get you. Paranoia may be a symptom of conditions including paranoid personality disorder, delusional disorder, and schizophrenia. Treatment for paranoia include medications and psychological support. Post-traumatic stress disorder (PTSD) is a mental health condition that can develop as a response to people who have experienced any traumatic event. This can be a car or other serious accident, physical or sexual assault, war-related events, or torture, or natural disasters such as floods. Psychosis. People affected by psychosis can experience delusions, hallucinations, and confused thinking. Psychosis can occur in a number of mental illnesses, including drug-induced psychosis, schizophrenia, and mood disorders. Medication and psychological support can relieve or even eliminate psychotic symptoms. Schizophrenia is a complex psychotic disorder characterized by disruptions to thinking and emotions and a distorted perception of reality. Symptoms of schizophrenia vary widely but may include hallucinations, delusions, thought disorder, social withdrawal, lack of motivation, impaired thinking and memory. People with schizophrenia have a high risk of suicide. Schizophrenia is not split personality. Thank you for watching the presentation.